Hi, my name is Kylie Christensen. I am going to be performing the skill of an intramuscular injection. First thing we're going to do before we get started is we want to make sure we're following the 6 rights of medication: right patient, right medication, right dose, right route, right time, and then right documentation. I'm then going to go ahead and verify the doctor's orders. The doctor's orders are morphine sulfate, 4 milligrams per ml. This is for intravenous or IV injection or intramuscular injection only. There are 6 milligrams there are 4 milligrams per milliliter, and so the doctor's orders are 6 milligrams of morphine administered intramuscularly. And that is going to equate, once we do our dosage calculation, to 1.5 milliliters. So I'll perform my dosage calculation after verifying the correct medication with another nurse to make sure that's correct. Once I have verified that's the correct calculation, I'm going to go ahead and gather my supplies. This syringe, this one is unopened, but these would be unopened. But I've practiced with them, so they are opened, but in the real world they would be unopened. Same with my alcohol and the gauze. Everything would be new and clean and sterile. For this one, I did select a 3 millimeter syringe, and then a 22 gauge 1-inch needle for the intramuscular injection. So once I have all my supplies, I will go ahead and head to my patient's room. Once I get in the patient's room, I'm going to make sure that the curtain is closed for privacy. I'm going to perform hand hygiene, and then I will introduce myself to the patient. Hello, my name is Kylie. I am going to be your nurse for today. Can you verify your name and date of birth using 2 patient identifiers? I go ahead and verified. Perfect. Thank you so much. Do you have any allergies to medication, environmental, or food that we need to be aware of? Thank you. Alrighty, so I am here to administer an intramuscular injection, morphine. Morphine is going to alleviate pain. We usually use it in patients that have moderate to severe levels of pain, and all it does is help block some of that signal in our bodies that tell us that we're in a lot of pain. So we're going to go ahead and do that as per the doctor's orders. A couple of side effects you might experience: nausea, vomiting, constipation is very common. Things that are not normal, if you're going to have any issues breathing, if you feel like your respiration rate is getting low, your blood pressure is getting low, or if you're having any dizziness, we need to know about that immediately. Okay, do you have any questions for me? Alrighty, perfect. I'm going to go ahead and check the computer one more time, and we're going to get started. So I'm going to wash my hands. I'm going to get my gloves put on. Once my gloves are put on, I'm then going to go ahead and pull up the orders. I'm going to verify the correct syringe, 3 milliliter, correct needle, 22 gauge 1-inch, correct medication, correct dosage. So this is morphine sulfate. This is 4 milligram per ml. We will be administering, per our dosage calculation, 6 milligrams, which is 1.5 milliliters. That's verified. Next thing I'm going to do is I'm going to go ahead and get the vial cleaned off. Perfect. While I let that dry, I'm going to get my needle prepared. Perfect. Once that's done, I'm going to go ahead and pull this down to 1.5 mLs so that I can inject air into the vial. So 1.5 mLs. I'm going to carefully remove the cap. Inject 1.5 mLs into here. And I'm going to turn it over, and I'm going to withdraw one and a half once we do that, I'm going to get rid of the air bubbles. Perfect. Double check that it is indeed 1.5. Oops. Okay. Perfect. So 1.5 ml. I will carefully recap this. If this was prepared not next to the patient's bed, we would make sure that we document this with the medication and the dose. Alrighty. Next thing we're going to do is we are going to inspect the site of the skin. These can be done in different places. For this administration, we're going to do the ventrogluteal site. So we want to make sure we are putting our heel down on the greater trochanter. Our thumb is going to be perpendicular to the femur, and our fingers are going to kind of go up towards the groin. Our injection site is going to be right between this pointer finger and our middle finger is where we will inject. When we administer intramuscular, we kind of want to use the heel of our hand on our ulnar side to provide the Z-track method to get some tension there. Before we administer it though and do any of that, we do also want to check the site for any issues with if it had a previous injections there, bruising, the size of the muscle, make sure this is an appropriate site for injection. Once we've verified the site is good, we're going to go ahead and clean it. So with my clean alcohol swab, we're going to go in a circular motion inside to outside. Dispose of that. Perfect. We're going to let it air dry. Alrighty, and then like I said, we're going to use heel of the hand, and then we're going to pull the skin taut, and then right in between there is where I'm going to go ahead and inject. With I'm going to switch hands, my non-dominant hand. And then I'm going to go ahead and inject. We want to make sure we're at a 90-degree angle as we insert it. When we're injecting intramuscular, keeping the skin nice and taut, we're going to inject all the way in, or press all the way in. And then we want to make sure that we are going at about 1 milliliter every 10 seconds, so nice and slow. Once we finish the injection, we're going to hold it in there for about 10 seconds to make sure that it goes in. Alrighty. We can go ahead and withdraw. If we had a safety, we would use it. We don't, and then we're going to put gauze on it here. We will dispose of this needle in the sharps container. And I'm going to hold this for about 10 seconds just on here. I can put a Band-Aid on it if it needs it. Once I've done that, I will go ahead and remove my gloves, dispose of them, make sure the needle's in the sharps container, take my medication, wash my hands, and go document my results.